Hi, I'm Julia Swagan, the director of Attuned Families, and I want to talk to you about parent involvement in the work that we do. So it makes total sense that parents bring us their kids. If you have concerns about your child or you're seeing things in them, obviously you want help and support for them. And child therapy does work, and we certainly go to great lengths to to engage kids and to make it not feel like work for them. And we are always trying to encourage and even strongly encourage parents to do some work with us as well. So we often take a family therapy model, and that can mean that kids are seen in their own sessions and then parents are seen separately. It doesn't mean that everyone has to be in the room together. But there are a few reasons we do this. Um, One is that we don't ever want kids to have a sense that they are carrying this problem by themselves. Having adults involved in the work, having their caregivers involved in the work, is actually therapeutic for them in itself because it takes the weight of the problem off of them. And that allows them to actually engage more meaningfully in the process. The other is that you're with them a lot more than we are. And so, if we can give you the high level caregiving skills that you need to support them day to day, that is actually going to have a much bigger impact on their behavior and allow you to meet your objectives for them a lot faster than us seeing them for an hour once a week. Um, the other piece is that sometimes what we're seeing in kids is actually an indicator of something happening in the family system that needs to be addressed. And so having just the child in session doesn't allow us to shift those dynamics in a meaningful way necessarily without involving other family members. And so sometimes the child in the family who is sort of the most problematic is actually doing a really, really important thing for that family because it's not that everyone in the family knows that there's a problematic dynamic happening. We get very used to our own reality. Um, and so that the important job that that child is doing is actually sort of ringing alarm bells and bringing to the surface and to everyone's attention, something's not working here. And so a family approach is really necessary in a case like that to shift the pattern. Um, so I hope that you're convinced and that you understand why, from an ethical perspective, we really wouldn't be doing our job if we were just seeing kids in isolation of working with their parents. So we really, really do strongly encourage, and we will bug you and try and get you involved in some kind of work to support the work of your child if it's the case that we're only seeing your child. Most of the families that we work with actually are already on board with this. Um, there are different ways that you can do parent work, and you don't have to do it with us. You can do it with whoever you're comfortable doing it with. That's totally your choice. In terms of what we offer, you can work with your child's therapist or another therapist at the practice, or you can also participate in the Attuned Village, which provides on-demand learning opportunities. By video, and then also a monthly group session where you can come and meet with a therapist live in a group setting and troubleshoot or ask clarifying questions and receive support that way. And also sort of we hope to build a community around you with other parents. And it can be really nice to see in that group that oh, there are other people just like me or very similar to me who are having similar struggles, and to feel that sort of sense of community and support. Okay, I hope that's helpful.